Welcome to our latest video podcast. Today I'm at Mitchell Field in Milwaukee, getting ready to leave Wisconsin from another weekend here, go back to Washington and do my work there. But we had a really great morning. I had a chance to announce a new bill that I'm going to introduce that will try to do something about the number one domestic problem I hear from people, whether I'm in Wisconsin or anywhere around the country, and that's health care. I believe that we ought to have guaranteed health care for every American. I think the federal government should require that. But I have come to the view, and I think a lot of people have, that we ought to give the states a lot of flexibility in how they do this. In other words, we have to make sure that everybody's covered at a basic level that's strong enough to make sure people are healthy. But every state doesn't have to do it exactly the same way. And I also know that people aren't ready to do this in all 50 states now. So I'm working with other groups and with Republicans and many people in the Congress to introduce a bill that will allow 3 or 4 states, or maybe 2 or 3 states, to compete to be pilot projects. In other words, states that would apply for a very significant grant from the federal government that would allow them to have the resources, matched by their own resources, to move toward universal coverage for all people in their state. The goal is to show that it can be done. The goal is to show that you can save money by actually having everybody covered. And my hope is if it catches on, that it could spread across the country. So I think this is an exciting proposal. I think it's an attempt to cut across the ideological lines. It's an attempt to get off the dime and actually get us to try to solve the issue that's driving individuals and businesses and doctors and everybody just a little crazy. And that is the issue of health care. So thank you for watching. I'm very excited about this proposal.